Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's video will be another video on the topic of COVID-19 infection, the hot topic, which seems to be lingering on, and more people are being affected by this virus in US, Europe, Asia, and across the rest of the world. And there's no slowing of this virus at this time. The mortality in US is continuing to rise, and as of today, 230,000 people have died, and over 8.8 million cases have been recorded. In India, 119,000 people have died so far, with about 8 million cases. In Brazil, another top of the chart country, 157,000 people have gone down with this illness, and 5.3 million cases are recorded. Luckily, in Pakistan, the mortality is still low. However, there are new cases coming up, probably the second phase of the illness, and people are still dying. A total of 6,736 people have died as of today, with a number of cases about 3.3 million. So we are still lucky that probably the cross immunity, because we are immune to other coronaviruses, that is helping. Probably herd immunity may be playing a role. But overall, the good news is that in Pakistan, the disease is still not out of control. And let's hope it stays like that. And for the rest of the world, disease gets contained. There has been latest research on the use of convalescent plasma. I know that the people have been dying to get it. Those people who are affected or their loved ones are affected in the critically ill position on ventilator therapy, they get that convalescent plasma, or they try to get it. And sometimes it may be ₹500,000 in Pakistan, not so in US or developed world, but underdeveloped world, people are really selling it at a high price. So there was an article that was published on 12th of October in British Medical Journal, BMJ, which is called Placid Trial. And it was on convalescent plasma in the management of moderate COVID-19 infection in adults in India. Open label phase 2 multi-center randomized controlled trial. Convalescent plasma is actually the antibodies in the plasma of people who have suffered from COVID-19. They donate their blood, and out of the blood, the red cells and other cells are separated. Only the fluid which is left over is high in protein and antibodies, and that is what is injected into those people with COVID-19 infection. So in this case, the moderately sick people, and what were the moderately sick people who were not in severe respiratory distress? So usually for adults, and this study was in adults, so usually in adults, the respiratory rate is 12 per minute approximately. And in these people who were moderately sick, meaning the lungs were affected, so because of the pneumonia or infection or early pneumonia, their respiratory rate was fast, and it was 24 times per minute. Oxygen saturation from 100 had dropped 93 or less, and these people were randomized into two groups, meaning one group got the plasma and other did not. A total of 464 people were included, and out of 464, it was kind of half and half. Placebo group, or the group that did not receive the plasma, were 235 versus other half in the plasma. And the plasma was given in two doses of 200 ml each, which will have the neutralizing antibodies, which will basically neutralize the spike proteins of the COVID-19 virus. And remember, COVID-19 virus is like a tennis ball with spikes on it. So those spike proteins, the neutralizing antibodies will neutralize, and the virus will not be able to bind to the respiratory epithelium, so there's less viral load or less viruses enter into the blood. And amount of antibodies in each plasma, since it was donated by different people, was different. And this number 446 and divided into two groups were considered to be statistically significant, the results in terms of their division, so that the data that would be generated would be statistically significant. So the outcome measures for this study were, number one was the prevention of progression towards a severe disease. So from getting just the oxygen treatment to going towards a stage in which you would need the ventilator therapy. And the second thing which was measured was what was the mortality from different causes at 28 days of treatment, and how many days did it take for the symptoms to resolve. So in the treatment group, 44% people progressed to severe disease and death, or 44 people, which was about 19%. And in the control group, which did not receive the plasma, about 41 people went into severe disease or death, and there were severe disease, and 18% was the total number of people. So one group had 19, another had 18. Those who did not receive plasma, even they had 18% of severe disease or progression to severe disease. So it was not really very significant. Then death or mortality within 28 days, 34 participants in the intervention group, or the people who got the plasma, versus 31 people who did not receive. So again, 34, 31, when they were run through the statistical test, they were not found to be significant effect. So significant enough that we should recommend plasma therapy. The third thing was progression to severe disease. So 17 people in each group went into a serious disease, meaning needing the ventilator therapy. So the results were that the plasma therapy is not significant in reducing either progressing to severe disease, preventing the mortality or death, or shortening the duration of illness. So that was the outcome of the study, which tells us that the people who are spending lots and lots of money on getting the plasma, people are selling plasma, should stop doing it, because it does not prevent progression from moderate to severe disease. It does not decrease the duration of illness. It does not decrease the death or mortality rate. And people had same results when it came to the duration of symptoms, people who needed the invasive ventilation, resolution of fever and cough, oxygen requirement, multi-organ failure. So basically it was the same result in both the two groups. And as far as the inflammatory markers were concerned, like lactate, CRP, they were similar. D-dimers, because these people, remember, also have risk of developing disseminated intravascular coagulation or clot formation in the blood vessels, causing stroke or obstruction of blood supply to different organs. So D-dimers were similarly elevated. D-dimers are actually the products of fibrinogen, which once it forms the clot, the fibrinogen strands are broken off, and they are called D-dimers. Neutralizing antibody titer was similar in the groups. So basically, it was not a statistically significant study. And initially, some symptoms may have been useful, like decrease in shortness of breath or fatigue at 7 days. But that was really not really significant. So that tells us that this plasma therapy is not useful. 36 people out of 38 who ended up needing the ventilator therapy, they died. So the prevention of death did not happen. So in a nutshell, we can safely say that this convalescent plasma does not prevent progression to the severe disease, does not prevent death and does not prevent the severity or duration of illness. And this is a very important study, and more studies like this are useful, but this study can be generalized on other different settings, different countries, different populations. And one of the professors of virology, Ian Jones, he said that it's not unexpected, the results, and he postulated that probably if plasma therapy is given at very early phase, it could help. But the question is, when you get diagnosed with the virus, people don't get the treatment, or you're just in quarantine. You only go to the physician's office when you have severe breathlessness, difficulty in breathing, fever. So how are we gonna administer plasma sooner is the question. And since the treatment is not widely available and expensive, you don't expect mildly infected people getting the treatment. And we don't have any predictive parameter to tell us that, okay, this is the person who will progress to a severe illness. However, we can debate the people with secondary conditions like old age, more than 60 years of age, heart disease, diabetes, immunosuppressive conditions, cystic fibrosis, severe asthma, chronic lung disease, chronic obstructive pulmonary disease. People who have lots of chronic illnesses may be the group that should be given plasma therapy at the very beginning or at the diagnosis of COVID-19 infection. So, in a nutshell, the treatments which are available, remdesivir was approved last week, which is antiviral medicine, which can prevent mortality. Dexamethasone has been shown in trials to be useful, so that is approved. And monoclonal antibodies have been given to different patients in serious conditions. Even President Trump also received, and they are synthetic antibodies prepared in the lab compared to the plasma, which are natural antibodies given to the people, acquired from the people who have recovered from COVID-19 infection. And this is a type of passive immunity in which you get the antibodies from other people. The active immunity is that through the vaccine you develop, or you suffer from an illness and you develop antibodies. So that is an active immunity, versus passive, you get the antibodies. Another example is the transplacental of antibodies from the mother to the child. So the active immunization is probably very vital in addition to our preventive measures, which include hand washing, face mask, social distancing, risk identification, that the people who are identified should be isolated in quarantine so that they don't become super spreader, and the immunization. That will be a breakthrough in the management of COVID-19. So far, the studies from phase 2 clinical trials from the vaccines have been very reassuring. There was a person who died in Brazil. It is being investigated that the Oxford vaccine that he received, he died. What was the reason for his death? He was a physician who was a volunteer, and we don't know what was the cause of death for that individual. So hopefully next few months a vaccine comes. So in addition to other measures, the virulence of virus goes down. There is bigger amount of cross immunity because of the immunity to other coronaviruses, and herd immunity may together help us out getting rid of this illness. Hopefully this video would be useful for you guys. Please subscribe to my channel and share this video with your friends and family. May Allah bless us all, and may Allah get us rid of this illness soon. Ameen. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Assalamu alaikum.